Good evening, friends. I am Dr. Ram Chadda, and I feel most privileged to be sharing this platform with a living legend. A living legend who's there not just because of his competency, not just because of his capability, but because of his character and his chemistry. I speak of none other than Professor Dr. S. Rajasekaran. Raja, as we all call him, is presently chairman of the Department of Orthopaedics, Trauma and Spine at the Ganga Hospital, Coimbatore, which we all know him to be. He's also the chair of the AO Spine International Board and the president-elect of the Asia Pacific Spine Society. There is no major position in spine or orthopedics worldwide that our friend has not held. To share a few, he's been the past chair of the AO Spine International Research Committee, president of the CSRS AP, president of CCOT, president of the Indian Orthopaedic Association, president of the Association of Spine Surgeons of India, president of ISLS, which is the International Society of Study for the Lumbar Spine, president of the World Orthopedic Concern, WOC, and chief national delegate of the Asia Pacific Orthopaedic Association. He is one of the very few from India to have delivered the Hunterian Professor Oration in the year 2011-12 at the Royal College of Surgeons in England. He's been a distinguished visitor to the Harvard Medical International Boston. He's been a part of the grand rounds at the Dartmouth Medical International in Boston. He's also been part of the Dartmouth University rounds at the Mayo in USA. He's been the adjunct professor of orthopedic surgery at the Dr. MGR Medical University. He's part of the Faculty of Medicine at Annamalai University. He's been a part of the planning board of the Bharatiyar University. He's been an editor with multiple international scientific journals, deputy editor of the Bone and Joint Journal, deputy editor of Spine, deputy editor of Global Spine Journal, editorial board of the European Spine Journal. He's had multiple research publications and awards and has been a recipient of almost every international recipient of any award internationally. His recent awards include the NAS Outstanding Paper Award, the North American Spine Society, the Asia Pacific Spine Journal Award for Best Clinical Paper. He's won the ISLS Prize for Spine Research on 4 occasions, more than anybody in the world. He's been probably the most cited Indian orthopedic and spine surgeon. He has 244 publications in international journals, 48 national publications, 446 international and 513 national presentations, contributed to 58 chapters in international books, and is the chief editor of the Video Atlas of Spine Surgery and the ASSI textbook of spinal infections and trauma. I have with me none other than my good friend, Professor Dr. S. Rajasekaran. Before I hand over to Raja, I have a small tribute which a few of our colleagues would like to share, and I am going to share their tribute first before we go over to Raja.
I have had this good fortune of interacting with him and hearing him speak a number of times.
That's great.
And every single time I heard him on any topic,
Please share the screen.
Perspective, not just about orthopedic practice, but about life in general.
I've attended many of your conferences, classes, and spine.
Are you unable to
You've
see
done
it, my
very
dear
well
friends?
Please share the screen, sir.
Okay.
Keep doing it. All the best.
He is the Sadguru of orthopedics today. I'm a great fan follower of you.
Are
and
you
always
able
try
to see it
follow
now?
No, sir. You have to share your screen.
your principles laid down by you.
There's a
And always
button
try
at
to
the
inculcate in
bottom.
me.
I have shared screen. Can you see my screen?
No,
is
sir.
in a class of his own. He has developed an institute with research
Can you see it now?
orientation,
Oh,
developing
now everyone can see.
Now can you see it?
Yes, sir. Excellent.
Interacting with him. I have had this good fortune of interacting with him and hearing him speak a number of times. And every single time I heard him on any topic, it gave me a different perspective, not just about orthopedic practice, but about life in general.
I've attended many of your conferences, plasties and spine. You've done very well for all orthopedic surgeons. Keep doing it. All the best.
He is the Sadguru of orthopedics today.
I'm a great fan follower of you and always try to follow your ethics and principles laid down by you and always try to inculcate in me.
Dr. Rajasekaran is in a class of his own. He has developed an institute with research orientation, developing newer technology, reaching out to the common man and the common person.
I have always tried to inculcate the ethics that you taught and the work culture that you practiced.
Rajasekaran is a researcher. Rajasekaran is a phenomenon. Rajasekaran is a visionary. Rajasekaran is a friend. Rajasekaran is a teacher. Rajasekaran is a family man. Rajasekaran is an administrator. Name it, there are so many things which we can add up to Dr. Rajasekaran.
You are a perfect blender of culture and spiritual and academic of orthopedics, sir.
Being an orthopedician, I am really thankful to Dr. Rajasekaran for his work and giving us the knowledge that required to every orthopedic surgeon for the country.
It is my intense pleasure to get an opportunity to express our great respect and honor to a great visionary teacher like you, sir. Even though I got a short period to get the experience of your surgical, professional and academic work.
He's a surgeon par excellence. He's a great teacher. He's a researcher. He's a great speaker and a mentor and a leader in orthopedics.
I consider myself lucky to have been trained under you. You have always been a great inspiration in my life. I'm in fact very proud to say that I am a Ganga alumni.
I have no hesitation to say that you have literally forced us to achieve something and become a better persons. As the students of Ganga, we always cherish those wonderful morning coffee meetings and motivation sessions what we used to have.
In my journey, I have not found a man who has got such an impeccable qualities as a human being and as a surgeon and as an institute builder and as a team leader.
So Raja,
Yes, Ram.
we are back to where we were. You've heard a lot of your proteges, a lot of your peers, some of them who've been with you and who've shared the journey with you, speaking about you. May I now hand over to you
Yeah,
to
Ram,
get
thanks a lot.
the ball rolling.
Ram, thanks a lot for this introduction. You actually had my adrenaline up with all these, this, and also so many of our orthopedic surgeons from speaking from all across India. It really was very soul satisfying. Legend is a very big name, a big word, and having been associated with it today, I feel humbled and honored also. So while there are many other legends, so many of my mentors, Professor Shantaram Shetty, Dr. Taneja, Dr. Devadas, Dr. Mailwan and Dr. Professor Shriram, I mean, they're all still there, but having invited me for this session, I would first of all like to express my gratefulness for this. And also, Ram, thanks to you for moderating. To have you moderate another legend in spine surgery is a great honor. So thank you, Alcom, and thanks everybody. And I really hope that everybody is really fine at this time of COVID. And let's pray God that we will come out of these challenging times very soon. Yes, Ram.
Thank you for your kind words, Raja. And I'm most humbled that I have had this opportunity of sharing the platform with you. But let's begin from where it all started. We all believe that we are here because we were the leading sperm, and that's the reason we are what we are today. But where did this leading sperm initiate his journey? Do you have certain childhood memories and things that you've inculcated from your lovely parents, whom we all respect so much, that you would share with us?
Yeah. Ram, my brother and I frequently talk of the ovarian lottery that we have had. I mean, I'm sure that every single parent is good to their child and every single parent wants the best for their children. But we have had such wonderful parents who have inculcated all the values and the character that it takes to be successful in life. If you talk of childhood, that's actually going many decades back, but I have few vivid memories which I can tell you. My father was a general practitioner and he came to Coimbatore at a time when the economy was very down. He was a general practitioner and also worked in a municipal hospital in the morning. And he used to have a cycle and used to have a leather bag, like a box, which used to have all the important things for general practice. Glass syringes in stainless steel boxes, which used to be boiled and autoclaved, stethoscope, a torchlight, a BP apparatus, and that was my actually first introduction to medicine. And it was our duty to get his cycle cleaned, and he was actually known as the cycle doctor in our area. But he had a clinic and it was a small clinic, and on the days the clinic boy didn't come, it was the duty of my brother and I to go and act as the clinic boy. We used to open the clinic, we used to get everything cleaned up, dust the table, dust the chairs and all, and act as the clinic boy. And even that was not just at that time. We had to do every responsibility at home. And even when you were in medical college, that was the time that Ganga Hospital was started. I was actually in my third year. And I used to always double up as whatever was necessary in the hospital. So I remember once that for a period of 6 months, we could not get a night duty doctor. So I used to go to the hospital and then come back in the evening, spend the whole night there as a night duty doctor, do everything and whatever was required. If there was a stretcher bearer required, we used to be that. If there was an emergency and if it took a longer time for one of our senior staff, Wellingry is his name, for him to come, then I would actually start cleaning the instruments and doing the autoclave, interacted with everybody. And these kind of exposure where we were on the side, doing everything and doing whatever was required, rather than whatever you liked, that actually put a lot of value to us. So we were not starving, but our parents never gave us unneeded luxury, and that taught us the value of money. That being introduced into medicine early got us interested in medicine very deeply. But more importantly, we understood the value of labor, to respect them. And also, it was so important. I remember that whenever there was an emergency, these staff nurses, I used to be associated with them when they were preparing the whole theater. And it surely realized even at that stage that these people were more important than the duty doctor who used to come and assist and go. So it made us respect the whole team. It showed us the value of the whole team and didn't allow us to fill ourselves with self-importance. So all through that childhood, I think the parents gave us the responsibility, the right measure of responsibility, the right measure of guidance, and the right measure of knowing what needs to be done. And I think this has actually carried on very well for both me and my brother. And this is something that we always cherish. That's why we always used to say we had ovarian lottery, because they brought us to what it was necessary to bring us to this stage.
Thank you, Raja. In fact, we've learned from what you've shared that you have lived a very frugal, thrifty life, and that has made you what you are today. And your parents have been actually extremely important in molding both your elder brother and you into what you are today. You went through becoming a doctor, your college days, which many of us have. I'm sure you have had memories that you would share with us. But what we found very interesting about you is that you are one of those successful doctors and colleagues who had a very early marriage. How did you manage your medical career, your college, and Rama?
You sound as if managing Rama is a very difficult thing. Well, actually, I got married early. I got married when I was doing my first year post-graduation. And it was an arranged marriage, but we had a considerable period of engagement period, which let us know each other quite well before we got married. And Rama was also doing her post-graduation in fine arts at the time. So that was a perfect setting for a good marriage. And this is, as you said, is a complete contrast to what I find now. Because most of the young doctors and fellows and professionals seem to think that getting married early is a negative aspect to your professional excellence. In fact, I can strongly say that it is the opposite. I mean, if you get married early, then that is the time, early in your life when you're a postgraduate, where you're a young doctor, you're filled with dreams, you're filled with ambitions, and it is a perfect, nice time. And you have to share it with your life partner. And it is also the time that you're very poor. You don't have money in your pocket. There is a lot of struggle. And it is the perfect setting where you can share your ambitions, your plans, and also all your struggles. And I think this is the time when this actually gels you both and makes a very happy marriage. In fact, I can say very confidently, when I got married to Rama, Rama was a student of fine arts. She was a great painter. She had ambitions of setting up exhibitions of her own, of her artwork, and she has held a few also. But, because at that time, I'm so lucky that she actually decided to give up her personal ambitions for taking up the ambition of a good medical setup. In fact, she not only gave up, but also joined hospital administration and did up to MPhil of hospital administration. And I don't think, but for those kind of support, I would have been so successful like this. So it is the magic of early marriage. So I think that's very important that you need to, I would like to tell every single young doctor, professional, don't consider an early marriage as a contradiction or a hurdle for your professional excellence. In fact, the time that you gel early in your life is what will stand with you for long times to come. So get married early.
Raja?
Yeah.
You did get married early and you traveled overseas. You went and had training overseas, you did your MCH, and you actually had a good job there as well. Do you suggest the younger generation should train overseas or stay in India?
I worked with the best of the people in our country. And I had the opportunity to work with the best surgeons in Coimbatore, Dr. C.V. Shanmugam, Dr. K. Shanmusundaram, Dr. Ravi Kumar, Dr. Pranesh. And also for the orthopedic training, I was trained under the two Doins, Professor Soundrapandian and Professor Shanmusundaram. I mean, there was a lot I learned in orthopedics, but going abroad and getting a training is very important for young surgeons. You'll get exposed to some amount of latest in the techniques. That's okay. But there is a whole lot of other things that you can learn. And especially in the late 1980s and 90s, it really helped me to learn about what is the importance of documentation and medical illustration. It even taught us what is the value of having a good secretary who can handle a dictaphone and type all your letters. I knew of professors in my time who used to prepare their own slides and who used to type their own letters. And I just going there, I understood what a good secretarial help will actually help you. There was a lot to learn about patient-doctor relationship, how to respect your patients, how to respect the people who work with you, what is the ideal sort of relationship that you should have with colleagues, and not only in medicine, but also general collegiality, and even how to drive on the roads, and so much to enjoy the beauty of Europe. So all this is really very important. And I would say that now having so much of exposure within India itself, a long training period like 4 years or 5 years is not necessary, but at least a short breaks of multiple trainings abroad is an absolute importance. I think it's very, very important. It actually widens your horizon considerably.
So Raja, you trained overseas, you learned the product, which is surgery, and learned a lot about the processes as well. So you learned what to do and you learned how to do it. Yet there was something that brought you back to India. You were given a position of consultant at a very young age and you had the option to stay on, but something brought you back to our motherland. Could you share how you took that decision and why you took that decision?
Well, Ram, staying abroad was never in the agenda for either my brother or myself. And we went with the fixed idea that we need to get trained and we need to come back early and we need to set up a very good unit. I mean, we needed to make Ganga Hospital good. That was the only agenda that we had. And that is actually a small story I would like to tell. I mean, if I can take it 2 minutes out of it. We both went to abroad almost on the same day and came back together, my brother and I. The initial idea was to stay there for 4 to 5 years, but however, it was shortened to 3 years, all because of one single event. You know, I did very well in MCH and topped the university and got the gold medal. So on the MCH dinner day, Professor Kleineman offered me the senior registrar's post in University of Liverpool. That was a prestigious post at the time. And the best thing with that is that if you do 1 year of senior registrar's post, you become eligible for a consultant. So while I was doing that position, one of the consultants, a very famous person, Mr. Beddow, took ill and then he had to retire. And then Professor Kleineman offered me that consultant's post as a locum consultant. He said, you just be there for 1 year and then I can't assure you, but almost for sure that you will be the consultant. And that actually I had to take a call because Professor Kleineman was offering a big position and if I had to take it, then I can't resign after 1 year. So that day I called my brother who was in Glasgow and said, this is what is happening. And Professor Kleineman said this. And he said, okay, I also have a similar situation. So why don't we talk this evening, this weekend? And he traveled to Liverpool and then we didn't have a lengthy discussion at all. It was all over quickly because we just asked ourselves only one question. If we take up this position and stay back in England, is it possible for us to call home and tell our parents that we are going to settle in the UK? And both of us took only 5 seconds to tell, no, it's not possible. And something strange happened because then we decided, well, if you're not going to stay here for long, then why don't we go back immediately? Whatever we need to train, we have trained. So what is the point in staying for more? And so the Monday morning, I went and gave my resignation letter to Professor Kleineman. And he actually asked me, what happened? Did you have too much to drink on the weekend? And I just explained to him the position. And he said, okay, I will not take this resignation letter, but come back and see me next week. And so I went back the next week and then gave him the resignation letter again. And he told me, you know, Raja, last night I was having dinner with Mary, and we both discussed about you. And we both fondly hoped that you wouldn't change your mind, because you need to go back and you will be happy there, and people like you are needed back there. So when I decided that, my brother also decided, and we virtually gave our resignation letters and came back over here. So it was not, I won't say patriotism or something like that. I won't use big words like that, but it was a strong attachment to the hospital, which we had been so closely associated, even though it was a very small hospital at the time. And also the place that we had to come back to our parents. So I would actually say coming back to parents was one of the more important reasons than a medical reason. And here, I had to thank Rama and my sister-in-law for having allowed us to come back. When I was in Liverpool, I actually found that 90% of the surgeons wanted to come back after their training, whereas 90% of the wives did not want to come back after staying there for 4 or 5 years. The strange family happening used to happen after 3 or 4 years abroad. In the first 2 years, you are homesick, and then after 4 years, you become sick of home. So they start complaining about smaller things in life and smaller things in India. We used to call the coconut phenomenon, that after 4 years, you're still brown outside, but you become more white inside. So when we decided to come back, Rama and my sister-in-law just said, whatever is good for you. And that is one of the important things that made us come back.
Well, Raja, that was great that you did decide to come back and you came back to India. What I wish to know from you is that when you did come back to India, you came back to Coimbatore. Coimbatore at that time was an extremely small city. Could you not have thought of Chennai, Bangalore, or even my city, which is Mumbai? Would you have thought of these options?
Yeah, okay. Bombay, no, because everybody said Ramchada is there, nobody else can survive. So Bombay was out of question. No, yeah, fun apart. Okay, when we came back, as I told you, we didn't think of all those things because our aim was to come back to our hometown. But actually, there was a lot of pressure. I mean, there was many of our relatives, many of our friends, and even many of the doctors. They always asked us, why don't you settle in Chennai? And the question was, should you move on to a bigger city? And also, if you're going to be in the same city, should you move on to a corporate hospital or a bigger hospital? We resisted that thought process, because if you actually think, why do we need a big place? If you look at, we had 2 big hospitals in our mind as our forerunners, and one was the Mayo Hospital. And if you see Mayo Hospital, it's out of nowhere in the US. I mean, right amidst the farmland. And we were very convinced that it is completely possible for us to do and set up a big place in a smaller place. And we always thought of this. If you complain that your workplace does not have a big infrastructure, then why don't you have the privilege of being the person who will build up that infrastructure? And we always thought that it is much better to establish an institution which will allow you to do what you want. Because having your own institution has many advantages. If you are in your own city, and this I would like to tell all young surgeons, because most of the registrars and fellows and also our visitors, when they come over here, ask me this question all the time. Sir, I want to go back to Bombay or Madras, and I always ask them, where are you from? And they will always tell a 2nd or 3rd or 4th tier city. And I ask them, why? And why not to your own place? And they will say there is no facility. But there are many advantages of going to your own place. Number one, people know you for what you are. and you don't need to sell yourself. And that's a very big advantage when you're doing medical profession. Like my father was very well known. He was known for his integrity and medical ethics. And my brother had a lot of friends and I had a lot of friends. So when we came back, everybody knew us and there was no issue of getting up what we want, and people came to us, and that was very good. So if you go to a large place, you are an incognito. You have to struggle very hard and you have to sell yourself very hard, and your runway is very long. You become a small cog in a big wheel. If you go back to your own place, you will be a big cog in a small wheel, and it will be possible for you to establish. And when you set up your own institution, you can do what you want. You can set the melody to your song. You don't need to set your practice to the tunes of somebody else. So you can set your own pace, you can set your own ambitions, and you can set your own ethics. And this is something I would say it's very, very important for young people. If possible, if you say that there is no big orthopedic setup in your place, just ask the question, why should I not be the pioneer who will set up this orthopedic facility in my place? Why don't I give back this big present to the place which made me? I think we did the right decision of being in Coimbatore. Thinking back, if we had settled in Mumbai or Chennai or Bangalore or any other big place, I don't think we would have been able to achieve what we wanted.
Raja, we respect your integrity. We also respect the fact that you wanted to be a big cog in a small wheel. But at the end of the day, you now become a big cog in a much bigger wheel. Let's look at how this wheel became bigger. When you did come back, both your brother and you, your father ran a small polyclinic, which didn't have an orthopedic department, if I'm not mistaken, and you joined government service. Could you walk us through your journey after you got back to India?
Yeah. So Ram, in 1980s, late 80s and the early 90s, the most prestigious position that you can have in any field was to be the head of the department and professor of that field in the local medical college. And also the only provision of being academic and also to have a teaching facility was when you are attached to a medical college. And so naturally, my entire aim was to be the professor of orthopedic surgery in Coimbatore Medical College. So when I did my MS, I got selected for the Tamil Nadu Public Service Commission. And after going to England and coming back, I wanted to join the medical college. So before going to England, I finished the 1 year of public primary health center service, rural service, and then went with the government order for advanced training in orthopedic surgery, which will allow me to come back and get into the medical education department. So when I came back, I was very pleasantly surprised, I should say overjoyed, when I found that there was a vacancy in the Department of Orthopedic Surgery in Coimbatore Medical College. And I thought God is smiling at me. And then I went to the Director of Medical Education. And again, there was another joy, because the then Director of Medical Education was actually one of my former professors who used to like me very much, because I even got the gold medal in her department, in her specialty. And she used to really like me a lot. So I thought it's cakewalk. I mean, she was the director, and then I went and saw her, and then the reality struck. She kept me waiting for more than 2 days to give an appointment. And when I told her, Madam, there is a vacancy in Coimbatore Medical College, she says, so what? That's none of your business. Just because you have come from abroad, it doesn't mean that you will walk into any vacancy that you choose. And then she did not allow me a transfer into the DME department, and then kept me in the rural service. And I was posted in a primary health center called Mangalam near Tiruvannamalai, which is about 400 kilometers from here. I did go and join there also. And just after some time, a few months, it was quite obvious that this was not going to happen. And so I went on long leave, and you know the famous saying, when God closes one door, probably he has plans for another door for you. And then we actually put our full concentration into Ganga Hospital. And probably it was a very big blessing in disguise that both my brother and I were made to go on long leave from the medical education department. And also it was good that after a couple of years when we started, the national board came into being, and then it was possible for you to do whatever you wanted to do in the medical college. You could still do a good teaching program in the private setup, and so that settled it. So after that, there was no looking back, and so we settled very comfortably to do good clinical practice and also good academics and research in Ganga Hospital. So it goes like saying, I mean, people in big offices do good to you either by giving you what you want or by refusing what you ask. They open a bigger door for you by closing one.
So it was something which was a hostile response, which was unexpected, as well as a lockdown that you probably faced at that time, which made you think on your way forward. So that is how Ganga was conceived. Today, you have a large hospital, which is an orthopedic and plastic surgery unit. It's boasting of almost 400 plus beds. This is where we are today, and the future is even bigger. How did this happen? How did you go through from what you had in the mid-90s to where you are today, and where are you going tomorrow?
Ram, this is a very frequently asked question. Everybody who comes here always asks, how did Ganga happen? I mean, it didn't happen by design. It didn't happen by very intricate planning or something. But looking back, I can easily tell how it happened. Everybody who builds an institution always wants the institution to grow. But you know, if you look at statistics, only 15% of these institutions grow for 25 years. And if you look at the institutions that have come up to 25 years, only another 15 to 20% reach 50 years and they are still growing. So there must be something more than just your desire to grow. And in my experience, I can actually tell you what it is, because we have learned about this from other institutions also. As you know, when we came, our role model was Aravind High Hospital. So in the first few months when we came, we didn't have much practice. And one day when I was seeing in the newspaper, in the Engagements Today column, there was a lecture in KG Hospital by one of the directors of Aravind Hospital. And my brother and I went to listen to him. And it was a very big, it was igniting passion. And then we knew that institutions grow by a purpose, not by your wish. If the purpose of the institution is beyond yourself, it is just that I want to build a big institution. No, if you reverse the whole thing and then you say, I want to build a very good orthopedic unit, taking you out of it, then I think it gets more power. If you also add a little more to it, then say, I want to build a big orthopedic unit which will be the best in the country, well known outside, which will be educating a lot of people, which will be teaching a lot of people and be doing a good to a lot of patients. I think then that purpose itself gives a lot of power to what you want to do. That we learned from Aravind Hospital and also many other big hospitals like CMC Vellore and Shankara Nendralaya Hospital and Shankara Eye Society in Coimbatore. Wherever the institutions were looking beyond themselves, it was growing. So my brother and I actually decided that the purpose of the hospital must be to set up a facility which will fill the need of the society. And at that time, replantations, revascularizations, major injury treatment, major spine surgeries or complicated deformity corrections were not being done in Coimbatore. And we filled the need of the society, but also made it affordable and available to all the patients at every single point of time. Whether it is the New Year Eve or it's Christmas or Deepavali, we just made sure that the same kind of treatment will be available for everybody over there. So this was very important. So we also did a lot of innovations on the way. And this is also, again, important. So one of the things, I'll just tell only one. We found that when you treat very complicated injuries, the most important problem was nobody has a big accident with money in his pocket. So if he comes to the hospital and then you ask for an advance, then it is absolutely not possible for anybody to fulfill that need. So we brought around a policy that we will not ask an advance from any injured patient, but go ahead with what is necessary and then they can pay later. Everybody laughed at it and said, you will be bankrupt because once the surgery is done and the treatment is done, who's going to pay for it? Well, actually, it worked completely opposite. People not only paid, of course, there were 2 or 3% who could not pay, but that's a very low number. But what happened is that people not only paid, but the reputation and the connect that the society had with the hospital became phenomenally good. And as a result, we became the preferred center for major injuries and all the orthopedic and hand surgery department issues. And that gave us the leadership in these fields. There was even a small saying in this place that whenever people are falling down, they are not shouting Amma, they are only shouting Ganga, and everybody is coming over there. So that is one part of it. You need to look at beyond yourself. Second is, I think you need a passion, and that passion will infuse like a blood transfusion into the institution. And when I say passion, it's not just ordinary passion. You have to be connected with what you do at a greater level and be willing to sacrifice a lot. I can go on enumerating all the big sacrifices, but this is very common for anybody who wants to build an institution. I'll just tell you a small instance. I think I might have told you also. Krishna Sweets for passion. Krishna Sweets is a very famous institution over here. And they got famous by doing Mysore Pak. And it always used to make me wonder, what is so great that other people are not being able to do this Mysore Pak? And one day, Mr. Krishnan's father was admitted in the hospital, and my brother asked him, what is it in your Mysore Pak that makes other people not make this sweet? And you will be surprised at the answer. He said, other people cannot make it because this has my blood in it. It has my sweat, my mind, and my blood in it. This is kind of that very consuming passion that makes institutions grow. So you also need to make a lot of sacrifices on the way, and that kind of sacrifices, because when you make institutions and make it grow, at many instances, there will be situations like do or die. You need to take a big risk. You have to have a situation like make it happen or you lose everything. But still, it is that passion in what you believe and what you want the institution to grow that makes you grow. And also you need a lot of family support and a good team. You need a family as the foundation, because when you see a big institution, you are looking at the skyscraper, the part that is outside. But many of the sacrifices are actually coming from the family. Your parents who guide you, your wife, your children. And these sacrifices are not yours alone. It's all of them. And all of this put together, it makes an institution actually grow. So you need to be having a right blend and mix of it. And we didn't plan. A lot of people ask, sir, when you started Ganga Hospital, did you ever think that it will grow into a 650-bedded hospital with 40 operating theaters? The straightaway easy answer is definitely no. I mean, we didn't plan by big design. We only took it from stage to stage. And we also expanded by necessity, not by over planning. We never built a big facility and then waited for something to happen. when we were too full and then we were too much pressurized for expansion, then only we expanded. So we never had the pressure of all this happening.
So Raja, Ganga was neither by default nor necessarily by design. It was probably a dream that you had. Then you had that deep desire. Then you had some discipline that you followed. And finally, you dared to do what you did and delivered. Very similar to what Walt Disney said, that you have to be extremely ethical with your work and do everything as well. That's what you mentioned about Sri Krishna Sweets. And that's exactly what you've done, that you have to do it so well every time that people come back to you expecting you to do it as well. And they'll go and tell everybody that this is how you do it so well every time. We are extremely proud of you, the way you've gone. But where are you looking at yourself, Raja?
Before your next question. Before your next question, Ram.
Yes, please go ahead, Raja.
Yeah, because you used the word ethics. So I will just tell one small instance which will be helpful for all the younger surgeons. So, when you build a big institution and when you expand massively, you get very worried. And we were about 130 beds in our previous place, and then we built into a 500 bedded institution. It was a very big leap, and lots of people were worried for us. All our good friends, relatives were worried for us. And at that stage, I was in a spine meeting in Hyderabad. And I came to the airport, and the flight was 2 hours late. And luckily, by the same flight, Dayananda Saraswati Swamigal, he is a very pious, learned man, was also waiting for the same flight. And he asked me, Doctor, how is the hospital going? I heard you are expanding a lot. And I told him, yes, Swamiji, but that's a big worry because we are expanding almost 300%, and I'm really worried. And he told me something which has been with me all along. He said, you should worry only if you think that you are the sole cause for Ganga Hospital. Then that's too much responsibility on your shoulder and you need to be worried. But Ganga Hospital is happening because it is destined to be. It is growing fast because of the good work that you are doing and good ethics that you are doing. And if nature believes that this ethics and the work culture is good, it will support and it will make you grow faster and bigger. So don't worry. You should not worry about the size. You should only worry about whether at certain point of time you will change your culture and your aims and objectives of this institution. You just look at maintaining ethics, and nature will maintain the hospital. So I think it's so good. I think that's something that really gave me so much confidence. I think of it often, and I think that's a good learning point of every young surgeon, that they should think beyond themselves and then look at their ethics properly. Then lots of things will be taken care of by themselves.
So ethics, integrity, and values are those which you will do even when there's nobody watching. Am I right? That's the way you're looking at it. And probably what the Swamiji told you and your belief in destiny, that you are probably just an instrument of a much higher, larger force. And you are there, and it is your time to deliver what you are. So that's great, Raja. And we wish and hope that your 650 bedded hospital 100 years hence would be a much, much larger thing, because I'm sure you're one of those who's looking at leaving a legacy which people will talk of at least 100 years hence. Let's move now to certain basic values, Raja. You've always been one of those who's had huge regard for proteges whom you've created, peers whom you've sparred with, and a few of them spoke, your closest of friends spoke so highly about you. And you've had role models and mentors. Today you are a mentor yourself, but you were a mentee at some stage. Could you speak on how mentorship actually carves the path for us?
Ram, you know my passion for the concept of mentoring, because I strongly believe that what you are is not only from where you come from, but how you have been shaped up. And shaping up is purely by mentoring. What you are is mostly on who has mentored you. And that's why when you see any successful person always recollecting their journey, they will lay a lot of emphasis on who's their mentor. And I can say for sure where you will be leading to and what you learned from your mentors stays with you for your life. I'll just tell you a few. I think I can emphasize this better by just giving a few examples. We all say you must be very concerned with your patient, you must be very compassionate with your patient, you must be very much interested, but you need to see that happening in your mentor. So I had the pleasure of working with Professor Ravi Kumar, whom everybody through Coimbatore Medical College will know, and he's an outstanding person for whatever you want to learn as a surgeon. And I was working with him as a house surgeon, and there was a sick child. And this sick child required an antibiotic. I think it was one of the third generation at that time, which was expensive, which was not in the availability in the Coimbatore Medical College. And when we were just talking, he told me he will always come for rounds in the night. And he had come there at about 8:30. And then he said, oh, this child really requires this treatment. And he just left. And, he went all the way back home. That's a half-an-hour drive up and half-an-hour drive down. And then he brought all the samples that he had at his home. And I was absolutely taken aback. So I told him, sir, you could have given it tomorrow morning. And he said, for this child, this 12 hours is very important. And so my 1 hour is not as important as this 12 hours for this child. These kind of instances just go straight into your brain. And you know what is meant by patient care and how much more you can do than just do what is necessary. I was also strongly influenced by another person, Professor Pranish. He is a professor of neurology. I almost became a neurologist because of him. And when I finished my MS, I came to him and I said, sir, I'm back. I'm going to start practice. He told me two things, and which is still today I follow. So he said, Shekhar, he used to call me Shekhar. He said, Shekhar, you will have a lot of VIPs in the future, but make sure you treat all VIPs as ordinary people and all ordinary people as VIPs. He said, you will never have a problem for your practice. This is really true. I took it to heart. And all of you know, in Ganga Hospital, we never have an outpatient cubicle separately, whether it's the minister or anybody who comes, we still see the same cubicle. No patient is seen in a single room or something like that. And that really reflected very well on our patients, and our patients really grew up. And he also said, for an institution to grow, if you are going to head it, you must be the first one to come and the last one to go. He said 90% of the problems will be solved by that. And I try to maintain this even today. Many days, even now, my work will be over by 6:30. But I know that out of the 10 consultants, at least 3 or 4 are going to be here till 8 o'clock. And so I always leave one day by 8:30 after they go. But these are some things that you can't learn in books, and then you learn only from these people. Similarly, I trained under Dr. Ramdas, and he's one of the reasons I took up orthopedics. He had a passion for instrumentation, and then I saw that his surgeries were completely different, of a different class, because he didn't worry about investing in AO instruments at that stage. This is in 1980s, although they were so expensive. And that actually made me to never hesitate to buy high-class equipments and technology, because I have seen even as a house surgeon that it completely changed over here. And Professor TK's, I can talk a long time, but I just want to tell this one small instant. He was an epitome of honesty and integrity. And I learned what is the value of being such a honest person. You know, when he was there, Professor Hande, Dr. Hande was the health minister. And one day he told me that in the outpatient department, he told me, Professor Hande, health minister will come at 8:30, so you please take him to my room. So I was waiting at 8:20 outside itself, and Professor Dr. Hande, health minister, came at 8:20, and Professor TKS was taking an undergraduate class in the outpatient department. So I took the minister to professor's room and then went to Professor TK's. He was taking a class. I told him, Dr. Hande's some minister has come. He just looked at his watch and he said, no, the appointment was for 8:30. I was so shocked. And then I went to the minister and said, Professor is taking a class. He said, please don't disturb him because he has asked me to come only at 8:30. Please don't even go and tell him that I have come. You know, such was the respect that these people got even at the stage. And these are the values that you can get only by seeing them and seeing how important to you. So all these important things of how to accept others people's mistake gracefully and how to accept your mistakes gracefully, how you can be correct but not too loud or aggressive, how to talk to a family whose family members are in severe dire, how to be ethically correct, and how to be ethically good in work, academics, and research. All these things which makes up Ganga Hospital, or all these things which makes up a good institution, how can it come from where else? Where do you learn other than good mentors? And I think all of us, we owe responsibility to our juniors also, that we not only teach them orthopedic science, but also how to be good doctors. I think
Raja, that's a phenomenal wisdom that you've shared with us, not just knowledge. And we are privileged that you are sharing these non-academic tips which make us what we are. But you must have also had situations where you've had to tip the balance. You've had situations where you have work on one side and you have life on the other. You've had times when you've had subconscious beliefs and you've had subconscious doubts. How do you manage this work-life balance? How do you keep using your camera, which can focus on work and then come back into a wide angle to look at your family and children and again focus back on work? How do you manage this, Raja?
Yeah. So Ram, this work-life balance is the most talked about and most confusing phrase, I think. Because work and life, these two words mean different things to different people. So first of all, it should not be equated for everybody. But when we were students and when we were junior doctors, nobody talked to us about life, or nobody talked to us about balance. Everybody told us work hard. And so this is a new concept which has come in the last 2 decades. And I think it is because not from medical profession, we sadly have borrowed it from the IT industry. So before the IT industry came, people always did a profession which they liked. They were either in their family business or they aspired for something and they went into it. But when the IT and the finance sector took high, people jumped into a bandwagon and they were working in a profession that they did not want, or they did not like, or they worked in groups that they did not know with each other. And they were frequently jumping jobs for a small increase in their pay. And so they were in a profession which they considered as work. And that is the actual one which actually tilted the balance, where people had to talk about work-life balance. But I am very strongly opinionated about this, and I have to say this is, I am biased towards work. Now, everything you want in life, your professional excellence, your social standing, all the wants in your life, and if you want to leave a legacy, then everything comes through work. So the work becomes a problem when it is not a profession. And we need to ask, nobody talks about profession-life balance. They only talk about work-life balance. Because when you are connected with your profession, and there is no difference between your life and the profession, there is no problem for this. So I always tell all my trainees that profession becomes work only when your work does not interest you. If continuously for many days that you feel very disinterested in going for work, then very early in life you must think very hard whether this is what you want to suffer the whole time. There is no problem with that work. It is just that you are disconnected with that work. The other thing is when you have an attitude and you're not interested and you think that you're working for others, and you're working for others' targets are not yours. And when you're working to build others' ambitions are not yours, then this is a big problem. Then you need to really think of what is happening to you, and you need to set things right. And when your work has a passion, it has your interest, then it is not stressful at all. And young doctors actually confuse a lot between hard work and stress. Hard work has not ever killed anybody, but lots and lots of people die by stress. And stress is doing something what you don't like, or something which you are not doing properly, or where you are not achieving success. So as there is a famous saying that stress is not doing what you like for 15 hours, but stress is doing something what you don't like for even 15 minutes. So if your work is not allowing you, giving you the happiness, and it is stressing you, that means you and your work are not connected. And so that is a problem. Then you will have to change. But if you are very passionate in what you're doing, if you're really interested, you never need to work about a stress that will come out of your life. But you know, this work-life balance is something that it is not yours alone. You need to be connected with your family also. And I find a lot of people who fail in their life, who are not able to achieve their ambition, or even have family problems, who end up in divorce, they start blaming the work. But you know, the divorce rates and family unhappiness is much, much more in people who don't have work. So if you have a problem at home, think again. Is it a basic incompatibility between you and your wife, your life partner, or is it your work that is being? Now, if you're not very successful in your life, I mean, I would like all the young doctors to ask their wives, do you need a highly successful husband, or you need a 3rd grade or 4th grade husband? And are you willing for me to work hard, for me to be a reputed surgeon? I'm sure that 100% of the wives will say, you do some hard work, but I don't want you to be 4th grade. If you want your wife to respect you, if you want your children to look up to you, it is hard work which will give you that position. And so I think there should not be a mixed match of unfortunate. We should aim to have a position where your work and your profession and your life is all blended together. One more important thing is you need to be off balance many times. I mean, if you have a family emergency, if you have a family concern, or if there is a stressful period at home, then those are the times you must deviate from your work and concentrate a lot on your family, and then you come back. Well, if your children are sick, then you go off balance towards your family, and then you come back to work. If you have a new job, then you go off balance and come back to do a lot of work and come back. So it is not like 50% work and 50% life all the time. You need to be off balance on purpose and achieve what you need to be on both sides.
Raja, you said that we get stressed or we have an imbalance of our work life if we are working for somebody else's dream. We are working for somebody else. Now, managers are those people who get work done. Leaders are those people who empower the team to want to do the work. How do you keep this huge team at the Ganga hospital, which is more like a family together.
Yeah. So Ram, a team is very important because however good you are, individual players can win some small games, but you need a big team to win big trophies. And I think everybody now understands that you need a big team and you need to be a part of a big team if you need to achieve very high. So it is both important. I mean, the team members and also as the team leader. And when I look at a new member joining our team, of course, intelligence, skill, and capability and technical skills are very important because if you're bad in that, then you will be a disaster for your patients and for your team. So you need to be good in that. But more importantly than what will build the team is whether the person is an affable person, he has adjustability, whether he is a team player, and will he be able to gel with the team? Because the last thing you want from a newcomer into the team is somebody very intelligent, very capable, but who rocks the whole boat and destroys the whole team. So we are very capable we are very careful in taking up a new team member. So we have a big luxury on this because we have so many trainees and who are training with us, and we need a new permanent member only once in 3 or 4 years. And we have a large pool from which we can choose. Lots of people at the end of training express their opinion that they want to join us. And then only when the entire team thinks that this person is good for us, then we would take him. So the reason how we can keep together, I think then it is the leader's responsibility. And I think that it's very important because when people become more skilled and more intelligent, then their capacity to be a team leader a team member becomes lesser and lesser. And I have also seen over a period of time, as they become more prominent, they assume professional leaderships, they get a lot of recognition, then the feeling of entitlement might sink slowly inside, and then they become less team players. So we have been very, very fortunate in having people who joined us as gold and remain 24-karat gold all through this period. On my side, I think it's my responsibility to keep the team together. So a leader has to be fair, giving the right kind of freedom. In Tamil, there is a proverb that says, no other tree or plant grows under the banyan tree. And if you have a team that needs to grow, you have to be a leader who allows others to grow in their own right and be recognized. And as you know, we are very good in it. Our team members have national positions everywhere. They are professionally recognized. They are the most sought after faculty. They are recognized. And I've always been keen that Ganga Hospital must be a stage which allows them to dance on the national and international stage very well. So all these are good, and you need to be sure that there is also a hierarchy and discipline maintained. People think being too free and having a lot of freedom is very important, but if you don't maintain hierarchy in a team, it will just split everything over. And as a leader, I just also need to be making sure that everybody stands for what we stood for from the beginning. And for each of us, as we become more successful and more recognized, we should not change colors. And as a leader, it is also my duty to maintain pace and progress of the unit. We have to be sure that this team is always winning. This team is in the forefront because nobody wants to be a part of a team which is not winning trophies. So whenever people get a little comfortable, little slow down, then, it's the part of the team leader to say, okay, let's start our pace again, and we have to maintain the pace. So it's the duty of the leader to maintain the direction and also to see that the pace of the team is going perfectly. Then everybody feels that it is a good part to be in.
We appreciate your leadership. There are various types of leaders in the world today. There are democratic leaders who listen to everybody. There are servant leaders who put their team in front of them. There are autocratic leaders. There are leaders who just do not respect the status quo. There are people who are spiritual leaders. And there are truthfully people like you who are situational leaders, which means you would need to change as the situation changes. Something which I go back to and which is very, very important to you and to me. You did mention that you were grateful to God in one sort of analogy when you were talking of a situation when you came back to India and you were facing your otherwise very passionate teacher who was rather hostile to you. And you did mention God there. Now, what I wish to ask from you is, do you have fear of God or do you have faith in God? These are two words which contradict each other. For me, fear is false evidence appearing real, and faith is full assurance in the heart. Do you have fear of God? Do you have faith in God? Or is there something in between?
Okay. Ram, I can always depend on you to ask such kind of questions. I know. Okay. Now, fear, I mean, it's your concept of God. One's concept of God keeps changing as you mature. And what you thought about God when you are a child is not going to be true when you are 40. And your concept of God when you're very happy and successful may not even be the same when you are in distress and sad. Now, there is no role for fear of God because fear of God will help you to be connected to God when you're a school child. But beyond that, it's not going to help you. So for me personally, I think I have gone through all these phases and, I am very religious. And one of the things is our whole family is religious. And I'm always very grateful to my parents for having instilled the faith in God. And that's one of the things that have kept me going. And in times of need and difficulty, to have a support that is beyond human nature. Now, faith in God is what you should have. And my faith and rather than, you said, is it something beyond faith? So let me answer that question as it's beyond faith, it's my need for God. And my need for God actually kept increasing over a period of time because at the early stage of life, if you make a wrong decision, then the only person that was going to be affected was yourself. But when you become an institutional head or a unit head, or also as your surgical expertise increases, and then you start doing very complicated cases, then you realize that you make a small mistake, you are not the only sufferer. I mean, lots of people are going to be affected by it. You do a bad job one day, and it's not just you, but it's a patient and his whole family is going to be affected by it. And once you realize that, it puts such a lot of pressure on you sometimes. And the only recluse is, I think, to have a faith, and that is the need in God. Actually, my need for God increased over a period of time, and now it is at its peak form, where you need real good guidance. And it is actually a buffer for you. Now, if you don't believe in God, and if you think that all the success is because of you, whenever you do very well, then that's going to make you feel very self-important and make you a very vain person. But if you think all the things that went wrong in your life, or the surgeries that you do, or a bad decision that you happen to take is also because of you, that's going to get you depressed and totally broken. So in times of high success, you have to shift the credit to God so that you become level-headed. You are not on somewhere in cloud 29 or 39. And in time of despair and difficulty also, you need to draw strength from God so that you know that this will completely go off. So that's why I think, you must be knowing Voltaire, the greatest revolutionary from France. He was one of the most sane person, but he actually said something very good. He said, God does not need us, but we need to know that we need God. And he said, even if God doesn't exist, I think we should invent God for our benefit. So I would actually say it's not fear of God or it's not faith of God, but I need God so that I can be stable in both times of ups and downs. You keep straight.
Thank you, Raja. I think it's something very, very important that you've told us. Most people say that there comes a stage in life when you have to keep your ego aside and let go. That's exactly what Rajasekaran has done today. He has let go. And truthfully, he has also shown us that the way forward is not just letting go, but letting God do it for us. Raja, that was great. It's indeed an eye-opener to have gotten to know so much from you at such a close distance. I'm sure there are more than 5,000 people who are right now a party to this discussion that I am privileged to have with you. And I feel really, really blessed to be here. Any final words that you may like to share, may it be with a family member, may it be about leadership, parenting, the present situation where we are, the lockdown, a future that we have no idea where it's taking us, anything that comes to your mind before we let go or let God take over.
Ram, one of the things that, I saw a few questions on the side that came from viewers, and I saw the question frequently popping up, can you tell us the recipe for success? And the people had written, what is the single factor that you attributed to your success? And some people have written, what makes an orthopedic surgeon into a legend and all that. So I also have to tell this, there is no big point of doing a big plan, that when you start as a young doctor, you don't start off by saying, I want to be a legend. And I am a little bit embarrassed to use this word legend, but still, because the topic of this is how this adds as legend, I use this word. So when you're a student, and this I have heard from my brother, he always used to say that he heard it from one of his mentors. The most important thing when you have to do when you are a medical student is to be the best medical student. You don't think of being a great surgeon at that time. There is no point of thinking that I have to be the best known surgeon or spine surgeon in India when you're doing your first year MBBS. At that time, your requirement is to be the best first year MBBS student, be the best person who has learned the most anatomy, physiology, and biochemistry. You get a gold medal at that stage because you never have a chance to come back and learn biochemistry and physiology. And when you're learning pathology, you have to concentrate on that. And when you're a house surgeon, you have to be the best house surgeon. When you are a postgraduate, you be the best postgraduate. When you do your first surgery, you make sure that you do the surgery very well. And when you're doing surgery, you don't think about something else on what is you're going to get in research. And when you're doing research, you don't confuse yourself with other things. So the only thing that you need to do at various stages is to do well what is expected out of you at that stage. And second is, you have to be ready to wait. And you cannot achieve what somebody has achieved after 20 years when you are 2 years into practice. If you're not patient, then Being impatient will lead you to do a lot of errors in judgment, and it will lead you into a path which is not correct. And these two things, and along with the factor that you need to put money, the value of money, very appropriately. Money is very important. And whenever I just actually talked in another surgical society, and one of the senior surgeons got up and asked, Raja, are you saying that money is not important because now you are one of the richest surgeons in the country? And I had no qualms in answering back to him. My idea about money has not changed when I did not have a stage when I used to search for a petrol bunk where it allowed not 1 liter of petrol, but half liter of petrol for my bike. From that stage to this stage, my idea of money has not changed. Money is very important, but if you are the best in the whatever you are doing, then there is no way you cannot be having a lot of money. If you're the best actor, if you're the best sportsman, if you're the best surgeon or a medical person, or even if you're the best dandruff specialist in the country, then you will be the most money. So if you take money out of all your decisions, you will make the right decisions, and that right decisions will make you very popular, and it will give you professional excellence, and that will give you a lot of money. So it is better to reach a lot of money through this route rather than to think of money and make a lot of wrong decisions and then lose your professional excellence. Third is surround yourself with a lot of good people. I think this is very, very fundamental. I mean, I would easily attribute my success to my parents, my family, my life partner, my children, and my brother, who's a big role model. That's one part. Good mentors who put you in the right direction. Good friends. That's something also very important because they make that journey very happy and they don't take you into a distraction. So there is a saying that says that you are always the sum average of the 5 people with whom you are always moving with. So you need to be very careful that you are surrounded yourself with lots of good people, and automatically your thinking will change and you will be very good. I heard from Mohit Bandari one saying, which I always say, he said, if you are the smartest person and the most accomplished person in the room, you are actually in the wrong room. You have to move into another room where there are more smarter and accomplished persons than yourself. And that will actually take you to the next level. I think this is also very important. You need to be with successful people. And that is one of the things that I have found very important. People ask me, you're already so busy. Why are you taking up these leadership positions in all these international associations? And I have found the single most important thing of this is not only to find how the world is working, but also automatically you start rubbing shoulders with all your mentors, all the people whom you thought are really the world leaders. And this takes you to the next position of thinking. So you always need to surround yourself with successful people. Just avoid all these guys who are always complaining, who are gossiping, who are always complaining the government is bad, that is bad, this is good, he's like that, he's like that. And this will give you so much negative energy that you are not a happy person anymore. Just yourself with successful people. And also be faithful to God. I mean, you need to believe in something. I'm not advocating that you should believe in God, but you need to believe on a stronger purpose, on some stronger energy than yours, so that at the time of success, you don't go overboard, and at the time of problems, you don't get underboard. So you trust in yourself, surround yourself with the family and good friends, good mentors, and you give back to the society what society has given back to you. That last part, actually, we have not discussed, but I'll just take 1 more minute. I know we have overtime, but you need to give back to the society because none of us are ever what we are by ourselves. Not even by your hard work, and none of us are ourselves by just our family, even if the family has given a lot back to us. None of us are even ourselves by the society, because what would happen if there is no medical college? What would happen if the government does not subsidize the medical college? What would happen to you without your patients? What would happen to you without your mentors? So it's something that you are drawing from lots and lots of people all the time. And at one certain point of time, you should start giving back. And if you do that, and if you can keep your head on your shoulders and not go berserk, and I think these are some of the few things that I want to tell all our young surgeons, because I saw a lot of questions addressed on this.
Thank you, Raja. It's been really an eye-opener. You've told us how purpose is more important than process, which is more important than the product. You've told us how you aspire to inspire us till we expire. You also told us that everything takes time. There is no instant gratification, and we need to sow, cultivate for an adequate period of time, and only then can we harvest. And finally, what you shared with us is that there has to be a belief system, a larger force, and we have to not prove to others, but try to improve on ourselves. Raja, extremely, extremely privileged to be here, listening to each word that you shared with us, and something which you said, which every orthopedic surgeon will take home, is that we should enjoy our work as a passion, and we should work for outcome and not for income. Thank you so much, Raja. We are really, really touched by every word that you've said.
Ram, I think you have summarized this much better than in a few minutes than what I spoke for a whole hour. So that's fantastic. Thank you, Ram, for this. Thank you very much.
Thank you so much, Raja. Thank you, Alchem, for making this happen. And I would like to remind each one of you that this Thursday, April 30th, same time, 5:30 onwards, we'll have Dr. K.H. Sancheti, and he will be in discussion with his son and his grandson, Dr. Parag Sancheti and Dr. Sahil Sangvi. It's going to be something where we would also learn a lot, and Raja and I are going to be there, and I hope each one of you will also be there. Thank you so much. Thank you again, Raja, and thank you for those 5,000 plus people who have been listening to us, and all those whom we could hear in those small video bites that they gave us. There were so many more questions, so many more video bites, but then we are constrained by time. Your time will also come. So thank you very, very much. God bless you. Thank you, Raja. Stay safe and stay healthy. Stay home.
Thank you, Ram. And thanks for everybody who have been watching us. So it's been a great privilege to be with all of you today. So stay safe, and something they say stay positive and test negative throughout this challenging time. Thank you very much.